Good morning, everyone, and thank you for being here today. I'm James Simoes on behalf of Protect Our Care New Hampshire. And today we're going to focus on a new report examining how major federal Medicaid reductions and changes to the Affordable Care Act funding will affect New Hampshire families, healthcare providers, hospitals, community health centers, and the state budget. And all this comes at a critical moment for healthcare in New Hampshire. Across our state, hospitals and providers are already facing workforce shortages, rising operating costs, financial pressures, and growing concerns about affordability. Now, new national data shows that Affordable Care Act enrollment is declining as premiums rise due to lapsed subsidies. Here in the Granite State, Medicaid remains one of the most important pillars of our healthcare system. It supports children, working families, people with disabilities, behavioral health, rural hospitals, reproductive healthcare services, and community health centers. So today we're going to take a look at what proposed federal changes could mean in practical terms here in New Hampshire, especially for rural communities and vulnerable populations. I'm fortunate to be joined by an amazing panel of healthcare and policy leaders. First, Kayla Montgomery, Vice President of Public Affairs for Planned Parenthood, New Hampshire Action Fund, and Planned Parenthood of Northern New England. I'm also joined again by Ed Shanshala, the CEO of Ammonoosuc Community Health Services and a leading voice on rural healthcare in Northern New Hampshire. And finally, Dr. Jennifer Mandelbaum, who's a physician and a state representative from Portsmouth. Thank you all for being here. Let's get right at it. I'll start with you, Ed, because you work directly with patients in rural New Hampshire, or I should say with residents of rural northern New Hampshire every day. What specific impacts will Medicaid reductions have on rural community health centers and staffing in communities that are already struggling with healthcare access?
Yes, thanks, James. So when we look at the impact of Medicaid, I like to start in the primary preventive space. So when we have patients come to us and get primary preventive care, uh, they don't need to have emergency care down the road. So when you look at a return on investment for every dollar we invest in primary preventive, we save $13 later. So when a patient's diabetes is well cared for, they're less inclined to show up at an emergency department. And our emergency department's around $1,500 per visit based on MEPS data. So it's significant. So when the Medicaid goes away and the co-investments in our friends, family, and neighbors' access to health insurance and access to care, we may see people put off care, things like mammography, breast and cervical cancer screening, uh, early childhood care, that we can catch things early. And if it is a chronic condition, we can manage it well together with the patient. So then they may present at the emergency department. It's going to be at a higher level of acuity. They may be uninsured. And as such, now that becomes bad debt for the hospital. So it's care later that was previously preventable. The return on investment is completely gone. And these hospitals that are already fragile on very thin margins are at increased risks. And then when we look at maternal child health, Spear Memorial Hospital delivers babies in Plymouth. Cottage ceased because they couldn't do it anymore over a decade ago. Littleton Regional does. Weeks does not. Androscoggin does. Upper Connecticut doesn't. So the access to deliver a child in a hospital is compromised. And those distances are substantive, and those distances increase time. And sometimes that matters how well things go for a person. So I'm concerned about the patients. I'm concerned about that entire continuum of care. And I like to invest on the front end in a variety of things, including patient care. So it gives me great pause that we're going to de-invest in our friends and families' health.
I think it should give us all pause. Investing in our community is one of the smartest things we can do. And I'd like to ask Representative Mandelbaum, both as an elected official and as a physician, nationally, this report we've just seen, and analysts are warning that millions of Americans may lose ACA coverage this year due to rising premiums, affordability concerns, lack of subsidies. What would that mean for New Hampshire's uninsured rate and our healthcare system? And if you don't mind factoring in, how will pending work requirements and copays um, fit into that mix?
Sure. Thanks, Jaime. So just to clarify, I have a doctorate in public health. I'm not a practicing physician.
My
Um,
mistake, and I apologize,
all
but
good. You can still call me doctor, but yeah, I think I I really think that it as Edward talked about, we're really dealing with a worrying situation. We've already seen that ACA marketplace enrollment is down around 17% since the beginning of last year. We're seeing declines of up to 30% in a number of markets. Our marketplace participation in New Hampshire is fairly stable and higher than it was in 2024. But certainly, if we lose coverage, we're going to see we're going to see a higher rate of uninsurance. And I think this is really interesting too, because from a perspective of Medicaid expansion. So, under current state law and the Granite Advantage Medicaid program, the expansion program ends automatically if federal funding drops below 90%. So, it puts about 60,000 New Hampshire residents at risk of losing coverage. So, I find that very concerning. We already have a shortage of providers, especially primary care physicians. There are some areas that have a patient to primary care provider ratio of about 2,000 to 1. So I think care is just going to become more difficult to access overall. It's going to be more expensive. We saw legislation recently in the New Hampshire House that added premiums for Medicaid recipients. So it's just going to add another layer of challenge.
well, thank you. And Kayla, I'd like to bring you in here. How important, given what we've just discussed, is Medicaid funding to maintaining reproductive and maternal health care services in our state, particularly in rural or in underserved communities?
Yeah, thanks, Jim. And thanks, of course, for gathering us together today to have this really important conversation. So Planned Parenthood throughout the country and also here in New Hampshire had the immediate impacts of the budget reconciliation bill. So right on July 4th, Planned Parenthoods across this country were barred from being reimbursed from the Medicaid program. So that was really the first thing that happened from this big, beautiful bill. So at Planned Parenthood, we have been feeling the impacts now for a long time, for 10 months. So we have been out of the Medicaid program. We are still seeing Medicaid patients. That's really, really important. But when a patient comes in and they're on Medicaid, we are still giving them the quality, affordable, life-saving care that they need, but we are not being reimbursed for it. So our Medicaid rates are zero. So certainly we would like to see Medicaid rates increase. Anything right now is better than zero. We are, supposed to be back in the program. This is supposed to expire in a year, so we have to go until July 4th. But of course, it's really hard to look into the future. We really don't know what it's going to be and if this is going to continue to harm us. So that is 1 in 5 patients in New Hampshire that comes to Planned Parenthood is a Medicaid patient. That's 20% of our patient base that we're not being reimbursed for. And of course, that is in addition to other factors that we've been seeing throughout the last few years. And that is from state impacts and from other federal impacts. We were out, Planned Parenthood of Northern New England and New Hampshire was out of the Title X program for 10 months. We weren't receiving that money. And President Trump has announced that it's not going to continue into the future. This is the nation's oldest and only family planning program that so many people rely on for affordable birth control and cancer screenings and STI testing. And of course, in addition, the Executive Council has defunded Planned Parenthood through state programs for the last 5 years. So we're really seeing a compounding of pressure that has come from these attacks. And I think it's really important to note that none of these attacks are from anti-abortion politicians, but this funding streams has nothing to do with abortion. So these anti-abortion politicians are willing to go so far as to take away healthcare for people just for their own personal politics. So, we've been seeing these attacks for so many years, and this is really coming through. We know that maternal health is really suffering in the state. In the last 20 years, we've seen 11 labor and delivery wings closed in New Hampshire. And there has been some really good bipartisan efforts around this with Momnibus 2.0, and trying to raise reimbursement rates for birthing centers, but it's simply not enough, especially in our rural areas. Telehealth can only go so far. So it's unfortunate we're seeing the impacts right now. And, everyone on this call certainly believes that healthier communities are a good thing and good for the economy. And we really need our government to step up, both state and federal, and support that work.
John, if I could chime in with one thing too.
Please do.
Because Kayla was talking about Planned Parenthood and reproductive health care. Nationally, about 40% of births are covered by Medicaid as well. And so I think any potential cuts just will compound the maternal health crisis that Kayla mentioned already.
Well, let me just follow up with you about that then, because one of the issues that keeps surfacing here in New Hampshire, and we see in the report, given what you just said, is the connection between healthcare affordability and access and the broader economy, right? Housing, childcare, workforce shortages, access to mental health care. So how concerned should we be here in New Hampshire about the long-term stability now of the ACA marketplace if enrollment continues to decline and we have these drops in Medicaid?
Mhm. I am concerned about rising premiums for the marketplace. We already have some of the lowest in the nation, which I think is something that doesn't get touted enough. But I think basic economic supply and demand, if we're seeing more people who are reliant upon marketplace plans, we might see those costs go up. Or alternatively, if we have people who are going to be more reliant on government funding versus ACA coverage, then we might also see prices rise because there will be less enrollment. I don't necessarily think New Hampshire has a strong track record of providing social services. I think, especially in the last couple of years, kudos to Governor Ayotte. I think she has made some positive steps in terms of mental health care access. I think that has been greatly needed. But we are still dealing with a housing shortage and explosive housing prices. It is very difficult to be, especially a young person in New Hampshire. And I mean, I really think that probably runs across the age gamut as well. You have people who are retired and on fixed incomes and trying to manage all of that too. So I'm concerned about our social safety net that's already stretched fairly thin. I think we will likely see a lot of philanthropic and nonprofit organizations stepping up, but also their budgets have been slashed and they're dealing with the economic consequences of people just having less capital to donate or volunteer. So I really think we're going to see an overburdened system be further overwhelmed.
Yes, thank you for that. And that would bring me back to Ed, and we'll return to you for just a moment here because, based on what we're hearing, behavioral health, substance use treatments are big concerns statewide, especially in rural areas, especially in the North Country. How could these Medicaid reductions affect access to mental health care, substance use treatment, and behavioral health care in New Hampshire?
Mhm. Yeah, so when we look at the expansion of Medicaid and the Affordable Care Act, where we co-invest, I prefer co-investment versus subsidy. Subsidy has different framework. And as a co-investment, my return on investment is my friends and family and neighbors are healthier through prevention, be it diabetes or depression. They're out contributing to society. They have great families. They get to play in the North Country and they have a job. So it's just a really good multiplicative investment. So we integrated behavioral health in 1998. So we were ahead of the game. So when you sit in our waiting room, no one knows why you're in our waiting room, or should they, nor necessarily how your care is being compensated for. And we do need it compensated because we're a not-for-profit. It's a tax status, not a business objective. We actually have to have a positive margin to reinvest in mission, patient care, and the staff we serve. So the opioid epidemic comes in 2018, and we're in the top 2 states, not in a good way, with West Virginia for injury and death. And so to the state's benefit, Stand Up at Doorways program, and that's had some positive effect. We've integrated behavioral health into K through 12 schools to get the behavioral health care to children sooner, so when they get to be teenagers, there should be less self-medication, less self-harm. So we went upstream. And then we went one more phase upstream with an early childhood development program from birth to 6 years old. So when these Medicaid cuts occur or the ACA co-investments disappear, it may adversely affect the children, if not directly, then indirectly, because now their parents don't have the resources they need to stay healthy. So that creates adverse environment for kids when their parents aren't getting the health care that they need. So we've made some progress in behavioral health, and it's through the investment of the expansion of Medicaid in New Hampshire and the Affordable Care Act, getting more people access to care. The Go North project has a very specific funding stream for behavioral health. That is important. I think it'll have substantive improvement, and it doesn't replace the fact that after 5 years, those monies are gone, and we will be left with cuts to access. So we'll have perhaps better integrated care, a unified electronic health record across behavioral health, and no one will be able to afford to go get it. And that worries me because sometimes these people end up in corrections, and I find it tragic that we have behavioral health courts and substance use disorder courts. As plottable as it is to get these people the care they need, it's a tragic statement of a failed society that they didn't get the care on the front end, and now we're providing it in a case of incarceration. It's tragic.
It is, and when we look at the recidivism rate for New Hampshire, it's a tragedy, extended, unfortunately. Um, I know we've got some media on the call, and we're going to give them a chance in a second through the question and answer app here in Zoom to ask any questions. But Kayla, I want to, in the report, I wanted to ask you, Protect Our Care is estimating as many as 18,000 people may lose their coverage through Medicaid in New Hampshire, and we don't yet have a firm grip on how many people are dropping coverage because they don't have subsidies through the Affordable Care Act. But from your perspective, so what's going to happen to all these folks, both patients and I think you could speak from providers as well, when people lose coverage, but still need ongoing care, medications, reproductive health care, maternity services? What does the future look like?
Yeah, it's a depressing thought, but people still need healthcare, regardless of whether they're insured, regardless of how much money they have. If you're not healthy, nothing else matters, right? We need to be investing in the health of our moms and our moms to be, because healthy moms makes healthy babies, which makes healthy communities. It's good for the economy. These are all important things that add to the value of New Hampshire and make people want to stay here, live here, work here, thrive here. At Planned Parenthood, it's been attack after attack. But at the end of the day, we still see patients. We still serve our patients regardless of their insurance status, of their income. If a person comes in and they need health care, we serve them. For some people, the ACA has been tremendous in things for sexual and reproductive health care regarding coverage of birth control. I think people sometimes forget, though, that even a $5 copay could prevent someone from getting that health care that they need. So when people aren't insured, they're still going to need health care. They're still going to come to us. We're still going to see them. But it just puts more and more stress on people. We know that if people can't get health care when they want it, they because they can't afford it, they push it out. And when you push out your health care, you become more sick, and that becomes more expensive. So all of this just leads to, unhealthy communities, and that is not something that we want. So if we really want to invest in a state that, keeps people healthy, we should have a strong public health network. And that means that the state should be coming in and filling the gaps that the federal government has left, or really investing in the work that the public health network has been doing for decades and will continue. But it gets harder and harder, and relying on philanthropy is no way to deliver health care to an entire state.
No, it's not. And thank you for that. I'll have one last question, then we'll see if there's any immediate questions. I'm going to ask the question of Representative Mandelbaum, which is, from your perspective, what policy choices could help stabilize healthcare coverage and protect access to care in New Hampshire moving forward? Do we have any good choices on the table?
Mhm. Well, I think what Kayla said is spot on, how if we limit coverage, that's going to really affect preventive primary care. And then we'll see people pushing their health care later down the line when their conditions might have worsened, which gives them both fewer options in terms of treatment, and also is more expensive for our entire healthcare system, especially when we think about how people with limited insurance coverage are probably going to be relying on public assistance on hospitals to foot that bill. So we're going to see a lot more uncompensated care as well. I think in terms of policy, this trigger law we have in place where once federal coverage reduces beyond lower than 90%, our Medicaid expansion stops. I think that's really troubling, and I think that's one place where the state and the legislature should be stepping in, and even if we can set the bar at 80 or 85%, that is still something. I am also concerned about these Medicaid work requirements. We're seeing how earlier in the legislative term, the House passed a bill that would require that would have work requirements. And I did vote for that bill because there's about $90 million of federal funding at risk. And it was kind of the lesser of two evils. And I think those are the kind of trade-offs we have to make in the legislature, where it's like, do you want to kick thousands of people off their insurance, or do we have work requirements that are onerous? And studies show that they absolutely do not work. I think to both of my colleagues' points around philanthropy not being a way to, create sustainable healthcare and our ethical obligations. I really think we're going to need to beef up our social safety nets. I think, unfortunately, that takes funding that the state says it doesn't have. I would argue that the state does seem to have money for some things that I think are a little bit less important, but certainly we all have different priorities. I think the second momnibus bill that passed is very promising. But I think we're really going to have to beef up those other social supports we have around housing and food access, and mental health care as well.
Well, thank you for that. Thank you all. I want to ask my colleague Rachel to join us and see if she's been gotten any questions from the media who are on our call.
Thank you, Jime. Yes, now we enter the Q&A portion of our conversation today, and thank you everybody for joining us, both press and participants. If you have any questions, please put those in the Q&A box at the bottom of your screen, and I will be monitoring that. If you have a question for a particular speaker, please note that as well. We did get a question submitted ahead of time by someone who could not make it today, and that's for Kayla. and that is how do Medicaid cuts impact access to reproductive care across New Hampshire and the greater New England region? And what will happen if more reproductive care deserts appear across the region?
Yeah, thanks for that question, Rachel. You know, like I said, Planned Parenthood, we've been here. Planned Parenthood Northern New England has been around for 60 years. We don't intend on going anywhere, but the pressures continue. It continues. It has been bad for a long time, and not being in the Medicaid program has been incredibly difficult. Even though it's, only a year, it is extremely difficult, but we still keep seeing patients because patients rely on us. And we know that if we turn away a patient because of their insurance status, they're not just simply going to go somewhere else. They're just not going to get care. They're just not going to get care, and then they're going to not be as healthy. Planned Parenthood is providing care uh, throughout the state. In fiscal year 25, we provided over 23,000 STI tests. That is just an example of taking care of the public and making sure that New Hampshire is healthier and that people can come to us for judgment-free care and be able to get that timely, affordable care as soon as they need it. Telehealth is a really important piece of the work, especially in rural New Hampshire. Within the last couple of years, we've had to close 2 sites in rural New Hampshire, one being St. Johnsbury, which is across the border, but still many patients from New Hampshire went there, and one being Claremont. So telehealth is able to help fill those gaps, but the brick and mortar locations are still incredibly important throughout our state.
Thank you very much. Next, we have a question for Representative Mandelbaum. That is, as we've discussed today, many Granite Staters have already lost their healthcare coverage due to federal cuts to Medicaid and the ACA, and there is an expected 15% cut to the state Medicaid budget throughout the next decade. What does this mean for your constituents, and how are you going to see the impacts of these cuts play out in real time?
That's a great question. I think, overall, we're going to see fewer people receiving preventive or primary care. And like we've talked about, they're going to wait until things escalate and they're in a more dire place in terms of whatever health condition they're managing, which is more expensive. I think ethically, we get into murky grounds in terms of prevent essentially making people wait to receive care until it becomes a much more difficult situation rather than primary prevention. I also wonder about the impacts this is going to have on people's job choices, where I think I think even for people who are not on Medicaid, we're going to see an increase in premiums for across the board in terms of health insurance for people who might be getting it through their work. So this really affects everyone. Even if you think that I'm not receiving Medicaid, I'm going to be okay. We're going to see much higher costs for employers and employees as well. So I'm really concerned about pricing across the board. I am also concerned about these work requirements that we passed in the House. Again, I voted for it because I felt like we just couldn't give up close to $100 million in federal funding. But we know they don't work, and we know that they just kick people off of Medicaid. So that concerns me as well. And again, just being able to access timely care is incredibly important. It's something we talk about all the time in public health, the importance of primary prevention. And if people can't get that, then we're going to be seeing them at a later point in time, when they're sicker, when it costs more, when there are fewer options available to them.
Thank you very much. Those are all the questions that we have time for today, so I will turn it back to Jaime. But if any of our journalists on today's call have follow-up questions, I encourage you to reach out after the call. Thank you.
Thanks, Rachel. And again, I want to thank the group gathered here Ed, Kayla, and of course, Representative Mandelbaum. It's nice to meet you, have you join our discussion. These discussions will continue, and let's hope that there's more positive news looking forward. This report is troubling, but it's because it's bad news doesn't mean that we should give up and walk away. I think it's very important that everybody in New Hampshire work hard, let their representatives, elected officials know the healthcare, it's just not a privilege. It's a right, and everybody deserves access to personal health, personal safety, and the knowledge that it takes to go to bed at night knowing that I can afford my medications, I can afford to see a nurse or a physician, I can take care of my family. That's, I think, a good place to invest, maybe more so than a big parking garage. I don't know. We can discuss that next time. Meanwhile, thank you for joining us, and we'll be back soon. On behalf of Protect Our Care New Hampshire, I'm James Simoes. Thanks for listening in.
Thank you.
Thanks, everyone.